Welcome! In this video, we'll walk through key coding steps for radiology X-ray services, covering CPT codes, imaging views, charts, ICD-10 tips, and common pitfalls to avoid. Let's get started. Let's review the CPT codes used to report this service. 73092, radiologic examination, upper extremity, infant, minimum of 2 views. This code is used when imaging the upper limb of an infant under 1 year of age. It bundles all regions of the upper extremity, shoulder, humerus, elbow, forearm, wrist, and hand, into one code when performed with a minimum of 2 views. 73592, radiologic examination, lower extremity, infant, minimum of 2 views. Similarly, this code applies to imaging of the lower extremity in infants. It encompasses the hip, femur, knee, tibia, fibula, ankle, and foot structures, as long as a minimum of 2 views is obtained. For diagnostic radiology, each limb is treated as a separate exam and coded individually using right and left modifiers. These codes are applied per extremity and not bilaterally bundled, so each side is coded individually. These studies are tailored to assess infant bone development, detect congenital anomalies, and screen for systemic skeletal changes like those seen in congenital infections. These pediatric-specific codes help limit radiation exposure by bundling multiple regions under one code if performed in the same session and anatomic extremity. Views: upper extremity, shoulder through the hand, AP view, lateral view. Lower extremity, hip through the ankle, AP view, lateral view. Report example: AP and lateral views of both upper extremities, AP and lateral views of both lower extremities. History: juvenile osteochondrosis evaluation for bony abnormalities. Additional history obtained from the medical record. Maternal history of syphilis, adequately treated per mother's notes. Comparison: none. Findings: of note, the distal portions of the right and left legs are not within the imaged field on the AP view of the legs, and the distal portion of the left forearm is not within the imaged field on the lateral view of the arms. Normal alignment: no acute fracture. No periosteal reaction, osseous erosion, lucent lesions, or metaphyseal irregularity. No soft tissue abnormalities. Impression: no radiographic evidence of congenital syphilis. Let's look at the views. Upper extremities, right and left, 2 views each. Lower extremities, right and left, 2 views each. These qualify for 73092, right upper extremities, infant, 73092, left upper extremities, infant, 73592, right lower extremities, infant, and 73592, left lower extremities, infant. In this case, the same CPT codes were applied to both the right and left sides of the infant's body, for both upper and lower extremities. According to AMA CPT guidelines and Medicare coding policy, use modifier RT right side and LT left side to report unilateral procedures performed on both sides. Do not use modifier 50 for diagnostic radiology services that involve separate anatomical structures like left and right limbs. Now, let's choose the appropriate diagnosis code based on the clinical history and chart findings. Report findings state: no periosteal reaction, osseous erosions, or metaphyseal destruction. No radiographic evidence of congenital syphilis. This means imaging is diagnostic, performed based on clinical suspicion, not confirmed disease. The most appropriate ICD-10 CM codes are Z01.89, encounter for other specified special examinations. Used when a diagnostic imaging study is performed in an asymptomatic infant as part of a workup to rule out disease. This accurately captures non-symptom-driven imaging with a diagnostic purpose. And Z20.818, contact with and suspected exposure to other viral communicable diseases. In this case, this code is used to indicate perinatal exposure to maternal infection, such as maternal syphilis, when there is no confirmed diagnosis in the infant. Correct codes for this case include 73092, right upper extremities, infant, 73092, left upper extremities, infant, 73592, right lower extremities, infant, and 73592, left lower extremities, infant. Z01.89, encounter for other specified special examinations. Z20.818, contact with and suspected exposure to other viral communicable diseases. A common coding confusion is mistaking infant extremity series for a bone survey. 77076, bone survey. Infant, is a comprehensive skeletal survey used to evaluate for non-accidental trauma, metabolic bone disease, skeletal dysplasia, or systemic congenital infection. It includes skull, spine, ribs, pelvis, and extremities, and should not be confused with individual extremity studies. Do not assign this code when only upper and/or lower extremity views are obtained. Bone survey CPTs are global codes and should only be used when the entire skeleton is imaged per ACR guidelines. Before we close, let's talk about the official age definition for these pediatric-specific CPT codes, because it's a common coding mistake. According to the American Medical Association, an infant is defined as a patient younger than 1 year old. This definition applies directly to CPT codes 73092 and 73592. If the patient is less than 12 months old, these infant-specific extremity codes are correct. But once the child reaches their first birthday, you must switch to the standard extremity CPT codes that match the specific anatomic site and number of views taken. Coders should always confirm the patient's date of birth on the report before finalizing these codes, because using an infant code for an older child is a compliance risk and can lead to claim denials. Thanks for watching. Be sure to check the links in the description for helpful resources and subscribe for more radiology coding content. CPT is a registered trademark of the American Medical Association, AMA. CPT codes are used in this video for educational purposes only and do not reproduce CPT descriptors in full. This video is not a substitute for the AMA CPT Professional Edition or official coding guidelines. Verify all codes with the most current CPT code set and payer policies before claim submission.